Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, urinary tract infections affect 1 in 5 women in their lifetime. And even though it is very common in women, men, children and older adults can get it as well. The biggest question is, can UTI go away on its own? Well, we find out after this fact of the matter. Urinary tract infection is a bacterial infection that affects the urinary system, including the kidneys, bladder, or urethra. A bladder infection may cause pelvic pain, increased urge to urinate, pain with urination and blood in the urine, while a kidney infection may cause back pain, nausea, vomiting, and fever. Although UTI is more common in women, it can also happen to men, older adults, and children.
My second born child, he was around 10 years by then. He used to complain of stomach pain, the lower abdomen pain. Okay, and also when peeing, also he used to complain of the pain. And sometimes the constipation was on and off, and slight fever. We did blood test, urine test, and stool test. Blood test and the stool test turned to be negative, but the urine test came out positive with UTI infection. First, the doctor wanted to know about my son's habit on toileting. So I told him that there is a time my boy normally holds his poo and sometimes even pee, because he was not comfortable whenever he was going. And until he reaches home, it's when he will go to pee and poo. He was given antibiotics, painkiller, and drugs for constipation to flush out the bacteria. He took medication for 5 days. After 5 days, he recovered. No reoccurrence. He's doing great, I thank God. At least he was able to take the doctor's advice and also my advice. The doctor advised me for him to be taking a lot of water to avoid taking long to go pee and poo. Also, he also advised me that the hygiene should be observed. The gentle hygiene should be observed. And okay, because he's a boy also, he advised me that to be cleaning his foreskin so that a bacteria infection does not accumulate inside the foreskin, to avoid the accumulation of bacteria. I used the insurance cover. The parents should observe the hygiene. School children, they should be using bathroom frequently. Those babies who are using potties, the potties should be very clean and well disinfectant. Another thing is that mothers should encourage their children to take a lot of water. Also, when a mother also discovers that the baby is these small children vomiting and having temperature, the mother should take the kid to the hospital.
All right, how about we get to understand more about urinary tract infection, or simply UTI? And of course, to help us with the conversation, we have Dr. Hussein Berger, who's a consultant physician and nephrologist at M. Fisher Hospital. So good to see you once again, Dr. And we also have Emma Otieno, who at some point struggled with UTI. And of course, she's here to also share her experience with us. Thank you very much to both of you for coming by today. So Dr. let's just start with the basics. UTI, we hear it on a daily basis, but don't really understand the intensity of the same. So UTI, what is it?
We can first start by defining what the urinary tract is. And the urinary tract basically entails the tract where the urine is formed and all the way until we expel it from the body. So it involves the kidneys, the ureters, which are the pipes that come out from the kidney going to the bladder, The bladder is where the urine is stored, and then from the bladder, the urine is expelled from the body through the urethra. So this is what entails a urinary tract.
Yeah.
Now, when you talk about a urinary tract infection, it means that you can get, it's an infection that can affect any part of the urinary tract. But most commonly, it affects the bladder, what we call cystitis. If the infection extends to the kidneys, then basically it is termed as pyelonephritis.
All right. So then who gets affected by UTI?
So UTI can affect both males and females, adults, children, and even the elderly as well. But most commonly, it affects the young females, especially the sexually active females.
Do we know why women are more at risk?
One is the short distance between the anal verge and the urethra. So most of the pathogens or the bacteria that cause a urinary tract infection actually come from the gut, from the colon. And these bacteria are found around the anal verge. So the distance to travel from the anal verge to the urethra is much more
Very
shorter
small, yeah.
for a female as compared to a male. And then the urethra for a female is very short. So it is easier for the bacteria to ascend to the bladder and to colonize the bladder. It is more common in females who are sexually active because of the fact that the urethra is adjacent to the vagina. So during sexual intercourse, it is actually the bacteria are pushed up into the bladder. So that is why it's recommended that after sexual intercourse, a female is normally expected to void, so that to expel all the bacteria and the pathogens through the urine.
Okay, and of course, before we talk about the causes, let's just speak to Emma. And you experienced UTI during pregnancy, right? Can we go back?
So I never used to get UTIs prior to my pregnancy, but right through my pregnancy, I started experiencing the UTIs.
And what trimester?
At the second trimester.
Second trimester, okay.
Yeah, and my experience was horrible because it was extremely painful.
Yeah.
You're just going to pee and the discomfort as well.
Just take us through your experience in terms of like the symptoms.
It started with the itchiness, and then it gradually developed to pain on my lower abdomen. And when I went to my doctor, they took some tests and confirmed that it was a UTI.
UTI. All right. And Dr. Ari, some of those symptoms, do we have instances where you might confuse it for something else?
It can be confused with pelvic inflammatory disease because it presents very similarly. You'll get the pelvic pain or the lower abdominal pain. The thing that helps us to distinguish it is, of course, when you get infections in the vagina or the cervix, you may get a discharge from the vagina. You get a vaginal discharge, or you get pain during sexual intercourse as well. So this points more towards pelvic inflammatory disease. While for urinary tract infection, like as she rightfully said, you get pain while passing urine or peeing, and it's like a burning pain. You also get pain in the lower abdomen when you're passing urine as well. And you tend to find that you're passing urine more frequently than normal. So those are all the cardinal symptoms of urinary tract infections.
Maybe something else that I wanted, just curious to know is, can UTI be a sign of something else, like some other condition happening in the body? So
if you get a recurrent UTI, then basically it could suggest that you could be having an obstruction within the urinary tract, one. If you get frequent and severe urinary tract infections like involvement of the kidney, then basically the patient could be immunosuppressed. So we need to look out for things like diabetes. Remember, diabetic patients tend to get complicated urinary tract infection. They're the ones who tend to get admitted with pyelonephritis, and sometimes it can become very severe and you can form an abscess or pus within the kidney itself, which now requires surgery. So if you get patients like this, then basically you need to investigate them for whether they have diabetes or not, or HIV. The other thing that we are seeing nowadays is TB of the genitourinary tract. So this is where the patient gets the urinary tract infections, and when you do the cultures, we grow nothing, and they keep on getting recurrent urinary tract infections. Then we have to start thinking about TB as one of the causes as well. and the specific tests we do for that as well.
Are there men who are more at risk? Because we usually hear about UTI in women.
In females, yes. So most commonly it is in females, and this is worldwide, but males can also get affected. More commonly it is found in the elderly males because of benign prostatic enlargement. So what happens is, if you have any obstruction to the flow of urine, like either you get a stricture in the urethra, or you get a prostate enlargement, like in the males, what happens when you hit 50 or 60 years of age. So what happens is the urine, I mean, you don't completely empty the bladder because of the obstruction. So some urine remains behind in the bladder. Now, urine is a very good media for bacterial growth. The other males who have abnormalities of the genitourinary tract, so those can also get recurrent urinary tract infections. People who have got kidney stones, because remember, kidney stones also cause obstruction as well. And in some cases, the stone also becomes a nidus for the bacteria to latch onto, and then it becomes difficult to clear.
So then again, how does it look like its presentation in men?
They would get a burning pain when they're passing urine. They would have increased frequency of passing urine as well. So it becomes very similar. Of course, there are some who only present with increased frequency of passing urine. And when you do the urine analysis, you find that they have an infection.
All right, and before we talk about children, she talked about an aspect of pregnancy. So do we see a lot of cases of UTI in pregnant women?
There is a certain condition called asymptomatic bacteriuria, which normally comes about in pregnancy. Now remember, especially in the second and third trimester, like what happened to her in the second trimester, where the uterus has started growing out of the pelvis. So it basically compresses onto the bladder as well, okay? And because of the hormones as well, so sometimes you can get incomplete voiding of the urine, and so you can get bacteria multiplying within the urine as well, but sometimes the patients are completely asymptomatic. So it is recommended that in your 12th and 18th week of pregnancy, you do get a urine test done for those women who are pregnant, so that in case if we do find that you have bacteria in the urine or a urine infection, then we treat it immediately, because it does portend a risk of early labor if you have an infection in the urine.
Emma, so for you, did you know what caused it? Did you know where the infection came from?
I think maybe it's from work, the public toilets, because that is the only place that I used to go to.
That is one of the things that, of course, a lot of people would associate UTI and use of public toilets. So, Dr. is that true, or is it more of a myth?
Okay, so you see, when you're using public toilets, it depends on what type of public toilets you're using. Yeah. If you are sitting on a bowl that has not been cleaned, of course, there's bacteria there, and the bacteria then stick to your skin and can ascend up. And this is why it is recommended that you always use water to clean yourself. The other aspect of it is if you are sharing bathtubs, although it's not very common. The other more commoner causes basically are if you are not voiding regularly, meaning that you're not peeing regularly. You see, a lot of people tend to fear going to bathrooms at their workplace, in public, and what they tend to do is to hold until they reach home. And what we recommend is for you to take lots of water so that you pee a lot. So every time you pee, you basically flush out the bacteria. So it prevents the bacteria from reaching the bladder and colonizing the bladder as well.
All right. And for children as well, what does UTI look like in children, both boys and girls?
For the infants, it's more common in the males because they tend to get what are called posterior urethral valves, so meaning that there's an obstruction there, and they don't tend to void completely. So for the infants, basically they may present with irritability, they may present with fevers, and then of course when we do the cultures and everything is when we pick up that they have a urinary tract infection, then you tend to do your imaging, the ultrasound, and pick up that there are what looks like posterior urethral valves because of the features of obstructive uropathy.
All right, so we need to go on a break, but of course when we come back, we want to understand. So fine, went to the doctor, told you you have UTI. Were you concerned? Were you scared? Because you're pregnant at this time. You just want to make sure everything is okay. And of course, your whole treatment journey towards the same. And of course, we'd also want to understand the diagnosis really and treatment of the same. And of course, all that is coming up after the short break. Stay with us. All right, welcome back. Glad you're still with us. The show is Health Diary, and today it's all about urinary tract infection or UTI. And of course, to help us with the conversation, we have Dr. Hussein Baga, who is a consultant physician and nephrologist at Mpisha Hospital, together with Emma Otieno, who had an experience with UTI. And of course, she's here to also share her experience with us today. So Emma, fine, went to the doctor, and of course, the diagnosis was done, and they found out that you have UTI. What was your immediate reaction?
Well, let's just say I wasn't that shocked.
Okay.
The doctor briefed me on everything concerning it, and also they prescribed some medication. There were some that for inserts, and I think I was also given an antibiotic as well.
And Dr., does it vary in terms of severity, or is this once you have the infection, you have the infection?
No, the severity does vary, and there are some people who can get very severe infections, and the infections can actually involve the kidneys. And when it involves the kidneys, it's called pyelonephritis, as I mentioned before, and that makes infection more severe. It's now subsequently called a complicated urinary tract infection.
So what then causes that? Is it that then the infection progresses, or what usually happens that someone ends up with a severe form of UTI?
So, I mean, if you have patients who are immunosuppressed, like let's say patients who have diabetes, these are the ones I've seen commonly who tend to get severe infections involving the kidneys. If you have abnormalities of the urinary tract, like for example, if you have an obstruction, if somebody tends to ignore their symptoms,
yeah, which is common,
which
right?
is very common, unfortunately, and this can also predispose them to getting severe infections as well. Yeah.
What do you think people ignore? Is it that sometimes we think that the UTI will just go away on its own, or we're scared to go to the hospital?
It's multifactorial.
Okay.
People are scared to go to the hospital. People are embarrassed as well to go to the hospital to talk about urinary, that they have a problem with the urine or they have a vaginal discharge. People will think that, yeah, it will just go away. Yeah, so it's multifactorial actually. Yeah. And in some people, they don't even get the full symptoms as well.
And then once it progresses to the kidney, what does that look like in terms of the presentations? Are the symptoms more severe maybe?
So by the time it becomes systemic, yeah, then you start getting fevers, you start getting flank pains, that's the pain at the sides here. You might develop nausea and vomiting as well. Yeah.
So then when it comes to the diagnosis process, what does it look like?
No, so when somebody comes with the classical symptoms and we do our examination, and subsequently, of course, we'll ask for the blood tests, the urine tests, and we also image the kidneys as well. Now, this is in adults. Now, in children, so what happens is now there are these urine bags, plastic ones that we basically stick around the urethra, yeah, and then we wait for the child to pass urine, and immediately the child passes urine, then the mother is then told to bring it to the hospital immediately.
So, and after that, what does treatment then look like?
No, so I mean, once when there's a urinary tract infection, then we basically give them the antibiotics, okay? Of course, if it happens in the males, then we have to worry about posterior urethral valves, then we have to investigate for that and refer them to the pediatric nephrologists and urologists. For the adults, it's the same thing as well. Once when you pick up a urinary tract infection, most commonly it is bacterial, so we put them on an antibiotic. The course depends, depending on the medication that you're using. There are some treatments that you just take a stat dose, yeah, one dose, and it clears it up. There are some we treat for 5 days. We can go up to 10 days depending on the severity of the infection. If it involves the kidneys, then we do 10 to 14 days.
But for you, so of course, can't remember, it was a long time in terms of how long you were on treatment, but did it clear completely, or Did you have like some case of recurrence?
No, it never recurred. After the treatment, I went back just to be sure.
Okay.
I think I was also a bit paranoid.
Yeah.
So after that, I went for another test just to be certain that it has actually cleared, and it did. So after that, I just became a bit also paranoid with where I was at least going to the toilets and everything, because at the back of my mind, it was I got it from.
Is the treatment different during pregnancy? Because we all know when you're pregnant, you're told, oh, don't take these medications and stuff.
It is very different, of course, because there are some antibiotics that we cannot use in pregnancy. So we have to be very careful, and we always insist, you have to ask whether the lady in front of you is pregnant or not.
All right, so to the very big question that people usually ask, can UTI go away on its own?
Well, it is a bit rare for it to go away on its own, especially when it's an established UTI that you have and you have the symptoms. Then you definitely need to get a course of antibiotics.
What causes the recurrence?
So one of the biggest risk factors for recurrence of UTI is if you have had a previous UTI. Other things as well, like as I told you, women who are sexually active, it does predispose them. It is recommended if you get recurrent UTIs to clean yourself from the front to the back and not from the back to the front. Drinking plenty of water and making sure that you pee frequently so that you avoid accumulating the urine and getting a urinary tract infection. Cranberry tablets or cranberry juice is very controversial as well. I have tried it out in some patients who get recurrent UTIs. It has worked. Small studies have shown that it works, but the larger multi-center trials have not shown any difference per se in terms of using the cranberry juice and whether it reduces the frequency. For women who have tried all of this and they still get recurrent UTIs, then we basically put them on prophylactic antibiotics for 6 months.
Okay, and
So
a lot of yogurt. We hear a lot of yogurt cases as well.
Well, even that is not really scientific as well, because the probiotics have not been shown to reduce the frequency, which is what yogurt is, the probiotics. It's not been shown to reduce the frequency of urinary tract infections per se.
All right.
But you can still take it, it's not harmful.
Yeah, it's okay. Yeah. Please do.
Can I ask him a question?
Sure.
In high school, I saw a lot of young ladies use garlic. Have you heard that? No. Like the insert, does it work?
Garlic.
Because
insert?
Yeah, yes. I saw that in high school a lot.
No, it doesn't work. Please don't do that. It's not good at all. Even using the feminine hygiene products that you'd use there's a very high risk of getting urinary tract infections using diaphragms or spermicides, because it kills the normal flora, which are protective, and they can predispose you to getting urinary tract infection.
Okay, so Emma, as we finish, very, very quickly, like 30 seconds, to all the women probably watching us now, afraid to go to the hospital or just thinking, what if not? It's a lot of the same. And even the aspect of cost as well. Did you have like any form of insurance? Did you pay cash? How much was it? Yeah.
So I had insurance from work, so that covered the cost. But I'd love to advise women that this is not an embarrassing topic. It concerns your health, and you come first before the embarrassment. So take care of your body, and just take the initiative to go to a doctor, talk to a doctor about it, and find the solution, because if you don't, it will come to bite you later on.
Absolutely, absolutely. And of course, Dr. as well, when it comes to cost and the whole aspect of stigma, when it comes to UTI, what would you say?
So if you are worried and scared and you stay behind with a urinary tract infection, and also if you are worried about the cost, it can become a complicated urinary tract infection. So something that will cost you, let's say, 1,000 shillings to treat and get rid of, ultimately then you end up getting admitted and spend thousands of shillings, isn't it? So it's better once when you get the symptoms, go and visit your nearest doctor, get a urine test done, get the treatment done, and you'll be sorted out immediately.
Yeah. So is it covered by, let's say, NHIA for most health insurances as well?
It is covered by all the private health insurances. It should be covered by the National Hospital Insurance Fund for the public hospitals as well. So it shouldn't be a problem.
All right.
Yeah.
And of course, very, very interesting way to end the show right now. Just go to a hospital. basically what we're saying, all right? Okay, Dr. Hussein Berger, consultant, physician and nephrologist at Mpisha Hospital, together with Emma Ochieno. We say thank you very much for both of you for coming by today. And of course, on that note, take a look at this health tip.
This one, let me show you for workouts for shoulders. We have what we call dumbbell shoulder press. You can do it standing or seated. Hold it this way, bend your knees slightly, and then take it up and down. There's another one we call shoulder raises, front raises, and this is how it goes. Bend your knees just out, then bring that arm there. 1, 2, 3. With the same dumbbells, I'm going to show you what we call side raises, still for the shoulders. Side raises, you do it, it's here. This is what we call side raises. You can alternate it this way, do it single, or you do both arms. 1, 2, it's called side raises. We are going to do shoulder shrugs using this our barbell. Shoulder shrugs, take it up and back. Take the shoulders up and down, also for the shoulders. That is what we call barbell shoulder shrugs.
Well, urinary tract infection is one of those topics that should be talked about because there is a lot of stigma surrounding the same. But from what we've learned today is once you notice anything wrong, please go to a hospital and get checked as soon as possible. Well, that is where we say goodbye right here on Health Diary. My name is Winnie Lubembe. Special thanks to 4 Points by Sheraton for hosting us. But if you have any other question, feel free to interact with us on our social media platforms. But until next time, adios.